Hello and welcome to Keep Talking, a community dialogue about mental health. My name is Gay Maxwell and I'm the manager of the Office of Continuing Education at the Brattleboro Retreat. The Brattleboro Retreat is an addictions and psychiatric hospital in southeastern Vermont where it serves children, adolescents, adults in support of their recovery. Today, we're going to be talking about a subject called coping with the holidays. Many of us, I think, notice on Halloween, the day after Halloween, that the candy flies off the shelves, that it's suddenly replaced with green and red and silver and gold decorations and ribbon and wrapping paper, and that the music suddenly pumps up maniacally, and the culture as a whole is just thrust into this frenzy of expectation and planning. And for some of us, that's a relatively happy transition. But for some of us, that's a time of loneliness, it's a time of anxiety, it's a time of feelings of dread, and sometimes very sad memories. So we're here today to talk about how to cope with those feelings when you may, the place that one might be is the last, you don't want to make merry. And you are coping with a lot at a time where you feel pressure to do so. And also, when is it a good time to seek out professional help when feelings of unhappiness and discomfort are making it too difficult? So I'm thrilled today because we have in our studio as a guest Dr. Robin Ostrander, who is the medical director, actually the senior medical director at the Brattleboro Retreat, as well as the medical director of the Child and Adolescent Services at the retreat. And I'm really thrilled to have you here. You have taken out time of your busy schedule, and I know it is a really, really grueling schedule in many ways. But the first question I wanted to put to you is, as a professional, what has been your experience as you approach the holidays? What do you see? What do you feel? What do you hear? As Halloween rolls into Thanksgiving, rolls into Christmas, Hanukkah?
Sure. Well, Gay, thank you. I'm so glad to be here. One of the things that I hear the most from clients, and I see both adults and children, is what you alluded to, which is really the power of expectation. So how does what I feel or what I feel like doing match up with others' expectation of me, or even sort of society's expectation of me during the holidays? And for adults, one of the beauties about being an adult is that you have some control over how you respond to those expectations and how you internalize them, how much you really take it on as your own. So yes, the music tells us we should be making merry, but it's really telling us to buy things. And that is a part of holiday gift giving for many families, but it doesn't mean that we are failing to live up to some particular kind of emotional state that we're supposed to be in. Mm-hmm. And I think most adults understand that. And then children who may not understand it may not also be as affected by the expectations as much, because the holidays are often organized around what comes to them as opposed to what they have to produce for others or make happen for their families. But what I often see, if we think about depression and the holidays, is two things. One, depression doesn't go away because it's a time where a person might legitimately have reasons to be happy. You may have adults in your family that you love who are coming to visit you. You may enjoy giving gifts and receiving them. You may enjoy the meal preparation and fun foods or even parties. And all of those things may be good. But for a person with depression, one of the cardinal symptoms is difficulty enjoying something that you used to enjoy. So if I'm depressed this year, and I wasn't depressed last year around the holidays, it's going to feel really different. The things that I looked forward to last time, I just don't look forward to this time. They may feel like a burden, or I might feel like I just don't have the energy, or it's just too much bother, or it just doesn't feel like it matters in the same way. And that, in its extreme form, psychiatrists call anhedonia. It's just inability to enjoy things. And in particular, social events are very difficult for a person with depression to enjoy. So that's something that can, it doesn't go away during Christmas time or holiday time, Hanukkah, so that's one possibility. Another thing that happens is that people feel like they're letting others down, whereas they may be able to cope with symptoms of depression without necessarily letting it affect other people. But during a time of year when they're supposed to be happy and joyful and giving and social, it's all the more apparent that they're just not able to kind of rally. And that can be disappointing for other people in the family who might not understand, for example, that I'm depressed. And I might, for reasons of stigma or other reasons, I might not want to tell them I'm depressed. So instead I tell them, well, I can't make it, or can we not do that big holiday meal this time of year, and that sort of thing.
Well, what would be important things for loved ones to notice? How would you notice if your husband or your child may be going through a hard time? What are the symptoms that someone might be concerned about?
Oh, sure. There are many symptoms, and each person will have kind of a different choice off the menu.
That's what I was going to ask. Is it different for different people?
It is, and really the ways in which it is different is that of the 20 symptoms that could be a part of depression, each person may have 6 or 8 or 10 of those, and not all of them. So some of the main symptoms of depression start with your mood. So you don't necessarily have to be sad and tearful, although that happens. Sometimes people get angry or irritable or just very anxious and restless, even in their bodies. You can have a difficulty kind of sitting through things they need to sit through. People can have feelings of kind of self-worth and self-esteem changes, like I feel guilty, I feel like I'm a worthless person, I feel like I've disappointed people. They can have difficulty with their thinking. I mean, depression is a brain disorder, so the brain stops working in various ways effectively when you're depressed. So we talked about mood, anxiety, irritability. Another thing that can happen is inability to make a decision, even a simple one. What should I bring to this party? What color dress should I wear? Becomes very difficult. People can have difficulty concentrating. They have difficulty finishing projects. They're just not as effective. They may be more forgetful. And they just may withdraw socially. That's something a family member might notice. And it's a change from their baselines. People have a different amount of sociability or enjoyment of social interactions kind of by nature. But if it's a real change from their normal, where they used to like to go out to dinner, they don't anymore. That was a party, that was a group they loved to hang out with, they don't want to go. They had a dance class, it's just not that fun anymore. And that's something you see in both adults and children, that kind of withdrawal from the things that they used to find enjoyable.
So in some ways what you might be saying, and correct me if I'm wrong, is that it's not necessarily the holidays that may be causing depression, but it may be that someone has a particular vulnerability, and the heightened frenzy of the holidays can sometimes rub and chafe at that.
Absolutely. So if, depression, if we look at it just across the board, is a very common illness. It's a serious illness, it's a brain disorder, it has effective treatments, but it is common. The lifetime prevalence, which means the chance that any time in your lifetime you may have a serious depressive episode, is about 16% for people. And it's more common in women, it's more common in Caucasians. The average age of onset's about mid-30s. It's less likely in younger children. And it is kind of an equalizer. We are all vulnerable. There's no one type of person that cannot get depression. But what causes depression is not always known. Certainly a significant stress, often it's a very significant stress, like a divorce, major job loss, a lost relationship, loss of a parent, that kind of thing, can trigger a depressive episode. That person may have gotten depressed at some point in their life anyway, but it happens at that moment because of that stress. Is the holidays enough of a stress to trigger a depressive episode? It's hard to know, maybe not for the very first time, but certainly depression can come and go for some people, and it could be a reason why it would get worse. And then there's one piece that might be worth us talking about, and that is, well, what about seasonal affective disorder? What about the light? You know, is it the Christmas season? Maybe that's not so stressful.
Could
but
you
the
talk
Christmas darkness.
a little bit about what seasonal affective disorder is?
Sure.
Because I think that's relatively, for lots of people, that's relatively new, and they might not even think that that's real, that it's sort of something you read about in magazines, but
Right,
it's not actually real. But it is.
It
There are
is
treatments
real.
for it.
People call it the winter blues, but seasonal affective disorder is the kind of accepted psychiatric term. And what it is a depressive episode that looks like others, but it has its onset in the winter months, and often at the time when the hours of daylight that we experience, at least in the northern hemisphere, really starts to go down. So for us, we may notice it around the time of daylight savings time ending. Maybe when we register, oh, we really have a lot fewer hours of daylight. And some clients have actually told me that they can feel a couple of different things. They can feel the rapid decline in minutes of daylight that happens in the fall, late September, early October. Other people will say, I can really tell when we get below 10 hours a day of sunlight, that's when I start to feel it. Or maybe I go to work at night and I come home at night, it's dark all the time. So what is that? Well, there are certain things we need for our mood, and one of them is thought to be vitamin D. Vitamin D is activated in our skin by sun falling on our skin. That's how we're able to turn vitamin D into the active form that we need to use it. And so it's a real thing. People in the southern hemisphere, people closer to the equator, do not get the same rates of seasonal depression that folks in northern latitudes do. So here in Vermont, it's one of our special gifts. We have a lot of darkness, which is coming on right now. And so there is a lot of seasonal depression. One of the amazing things about seasonal depression is that it can be treated with a really novel treatment, which is light. We lose light, we can treat it with light. About half of people with seasonal depression will improve with light therapy alone. So what is light therapy? Is it, sticking my face in this light right here? Not so much. There are types of light that are called full spectrum that are trying to mimic all of the different colors and wavelengths of light that the sun provides for us. And so being in the sun is a best choice. We don't have that here in Brattleboro today. I mean, it's sunny today, but the sun will go down, and
That's right.
4:30, 5 o'clock, it'll be done. So there are commercial products that can mimic that full spectrum light, but they have to be at a certain brightness. So those bluish full spectrum light bulbs that you put into your lamp won't do it. It has to be a special light that people call light therapy or a light box. They need to be 10,000 lux in brightness. And there are a couple of companies. There's a Vermont company called Verilux. There's another company called Sunbox that sell these lights. And often they're even reimbursed by insurance companies if you have a diagnosis of seasonal depression.
So it's probably preferable to get your doctor to not to go out and can you go out and buy one if you want?
Oh yes, you do not need a prescription to buy these.
All right, but you think maybe you should check in with your doctor?
I think if you are noticing that you're feeling down or blue or tired or sad, or some people say they feel like they're going into hibernation, I just want to eat and sleep and I'm crabby all the time. Those are signs of depression, and it's worth talking to someone, a therapist, your regular doctor, or nurse practitioner, physician assistant. It doesn't necessarily require going straight to a mental health professional to say what's going on. But there's no need for a prescription for a light box. You could get one and plug it in and see what happens. One of the ways we know that these are effective is that they have side effects, just like other treatments, including medication. And one of the side effects for a light box is that people who may have something called bipolar disorder or manic depression can become manic from sitting in front of the light. And so that's unlikely. Bipolar disorder is far less common than depression, but it's certainly a danger.
But it's something to pay attention to and to have a professional monitor with you.
Absolutely. So at when you start the light treatment, you have someone to say to, hey, this is how it's going. And the other issue is that only half people respond. So if you're depressed and you're in that other half who doesn't respond to the light therapy, well, you may still want to feel better. And so you need someone to talk to about alternatives.
So when you talk with your patients about coping skills during the holidays. You know, that they are in a particular state where this is painful. It is rubbing and chafing at them, and they're uncomfortable. What are the things that you recommend that they can actually do besides, you know, a light box, or in conjunction with a light box? Or we haven't even talked about medication yet, but you know, what are the coping skills that you recommend?
Oh, sure. Well, you can look at it from two ways. One is, is there any evidence that there are kind of non-medication things that you can do to improve your mood? And there's some evidence of that. Exercise has some evidence that it can support mood. The standard things everyone may know but are very hard to do. So don't overuse alcohol, don't overuse caffeine, get enough sleep, have social contacts that you trust, that you can check in with and just get support. Be active. You know, it's that going through the motions thing. You may
Fake
not,
it till you make it.
Right, you don't feel like going to maybe every party, but try not to go to zero parties. You know, pick the ones that are least effortful.
Because it's actually those connections are sometimes the very thing that produce, you know, the dopamine or make you feel better.
And there is power in distraction. When a person is depressed and they haven't started to feel better yet, they may be spending a lot of time thinking thoughts that are really no fun. They're thinking about how life is no fun, how they are a useless person, how they failed themselves and others, and there's really no progress to be made by sitting with those thoughts all day long. And so just getting out and going for a walk, or taking your dog for a walk, or having a really doesn't have to be important conversation with anyone, can just get you out of your own head for a minute and connect with someone and stop kind of ruminating about those thoughts about things you can't control anyway.
I heard someone say that a very good coping skill for feelings of depression were, well, one, using both your hands in some activity. For instance, playing the guitar, knitting. Apparently, when you use both hands, it does increase dopamine levels. I also heard that, and baking, filling the house with baked smells is apparently alleviator. And what was the other one? The other one was cleaning. Not that I think that depression would ever make you feel like cleaning, but perhaps it would. I mean, perhaps that would help and lift.
Right.
You know?
Some viewers might be thinking, "Are you kidding me? I already feel bad about not cleaning, and I'm supposed to clean." I think
sorry.
Yeah, there is value in feeling like you've done something positive, and so many people will say, "Well, it is really clear when I clean my kitchen that I've done something positive." It's small, but it's visible. It's really clear, and people will come home and say, "Wow, the kitchen looks great." So you think, "Okay, I did something positive today." There's value in that. You know, it's not going to change the world, but it might actually change your day, and you might just feel better to be in a house that is as presentable as your house can be. One of the things about keeping your hands busy is also important. I think doing things that use both sides of your brain requires using both sides of your body. And so knitting, crocheting, playing cards, those kinds of things are really helpful. The music can be very powerful for people who have those skills and talents. So I always recommend that they play if they can, or listen if they don't play.
Right.
But the really important thing is not to search the world for coping skills with depression, but to get treatment. Because there is no good reason that I can think of for suffering unnecessarily. So when do you look for professional help?
Yes.
Well, when you are in pain, when you're causing pain to others because, you know, your spouse says, "I've been asking you to go out to dinner with me for 3 months and you said no," or, you know, another cardinal symptom is loss of interest in romance, and your partner may say, like, "This isn't working for me," and you might say, "Well, I just don't have it, it's not in me." And you can tell that that's putting a strain on a relationship that's important to you. That's a reason to get help. When you feel suicidal is the cardinal reason, get help. If it even enters your mind, boy, I would rather be dead than deal with how I'm feeling. It's not, you're not planning something necessarily, or you're thinking, boy, I just don't see a point in going on. That is something to take note of and say, well, this is not normal. This is not okay. a brain that is functioning well does not plan its own demise. We have an inherent desire to keep going and keep living, that zest for life. And when that starts to get chipped away at, depression is real and you need to respond to it.
Yes, and when you talk about treatment, getting treatment, what does that look like? What are the different ways? I mean, I know that there are medications, I know that there are medication in conjunction with psychotherapy. Tell us about the various things that work for depression.
Well, for mild to moderate depressions, it almost always makes sense to start with therapy. Not everyone wants to start with therapy because it is time consuming and it is sometimes hard to get your insurance to pay for it. And it might be easier to go to your primary care provider and get a prescription for a medication. And neither one is wrong. There's no wrong answer. Medications can treat mild to moderate depression. Therapy can treat mild to moderate depression. When depression is severe, like if you have ever thought about suicide, or you're not going to work, or you're not functioning really, at the level that's expected of you, then, and I guess one other thing I would add is if you are responsible for the care of another person, of a parent, of a young child, and you're no longer functioning, well, that's an added burden now on two people. And so you may want to intervene with your own depression sooner. Even if it's just for the other person, if you might not do it for yourself, you might do it for your child or for your parent or for whoever it is that you're a primary caregiver. So what are the options? Well, there are two specific types of therapy that have copious evidence that they work. And they have pithy little names, CBT and IPT. CBT is cognitive behavioral therapy, and IPT is interpersonal therapy. And these are treatments where a therapist has had education. They've gone to continuing education or they've had supervision, they've read books, and they are standardized treatments. It doesn't mean the therapist will say the same thing to you every time you go, or that if you picked 100 therapists, they would all do it the same way, but that there are specific goals, and they are well validated by evidence that depression can remit. And we're not talking about a lifetime of therapy, we're talking about 8 to 12 weeks of therapy. And so that may feel like a big time commitment, 2 to 3 months of going once a week for an hour and speaking to a therapist, but often people have suffered for months to years. And they may actually not believe that they could get better in those 3 months, and that's why they don't try, not because it is so onerous. And there is something that is really special and I think unobtainable besides with a therapist, and that is when you see a therapist, that person does not have a personal agenda in what you do with your life. It's not like talking to your sibling or your mother or your spouse who has a vested interest in you getting back on track and may actually be kind of annoyed and mad that you've been poorly functioning, even though they may know in their heart that it's not your fault, that you could have had diabetes, but instead you have depression. They may know that, but in their lives, they're being impacted by your depression. They would like you to get better ASAP. A therapist is not emotionally invested in your outcome. They are invested as a professional in you reaching your goals. So they want to know, what are your goals and how can I help you get there? And I won't be mad at you if it takes you longer than it might take someone else. It's okay, and they'll work with you to get you there.
So how do people find help?
Well, they find it in a couple of ways. You can call us at the retreat. You could call 1-800-RETREAT, and we have outpatient providers who will be your therapist or who will guide you to someone in your region, because we see clients from multiple states. I think it was, almost all 50 states and 27 countries last year came to the retreat for care. And we are not just an inpatient facility for people who need to check into the hospital. We have outpatient supports, and we're well connected with people in the local community as far as other therapists. There are therapists in private practice, but who also will take insurance. There are therapists who will take your cash if you don't wish to use your insurance or if you don't have any. So there are multiple ways to get it. You can also start with your primary care provider and call the office and say, I think I need to check in with a therapist. Who do you recommend? You can ask people you trust. There are clergy, people you volunteer with, neighbors, your friends. It is not possible that no one you know has ever been in therapy. You might just not have asked. And they may be willing to tell you very frankly, oh, I went to see this therapist and she's great. Here's her number. I would love to help you. I'll even drive you there, kind of thing. If you're looking for medication, which we didn't talk about.
Nope.
And when do you consider medication? Well, if your depression is severe, you might want to consider medication right away because you may not respond right away to treatment. You know, if it takes 8-12 weeks to respond to therapy, it may take 5 to 8 weeks to respond to a medication. If you are very, very ill, why wait? If you're suicidal, do not wait. You could die before you start to feel better. So that's one category. If you've been in therapy for 8-10 weeks and you're not feeling better, it might be time, and you really like your therapist and you're giving a good effort, it may be time to think about medication, either as an adjunct, adding it onto the therapy, or switching. There are a couple of kind of age categories for teenagers and for elders. There's not a lot of evidence that therapy alone is enough, that medication plus therapy is the best way to go. It beats meds alone and it beats therapy alone. So for elders and teens, medications plus therapy can get people well faster.
I always feel that the elderly are oftentimes neglected in terms of their need for support around depression, and particularly as people who are constantly facing loss, that they oftentimes could benefit from medication, and it oftentimes is not prescribed to them, often enough anyway.
Absolutely. I mean, there is so much stigma around elders in this culture that doesn't necessarily happen in other cultures, that you could be given so much respect and accolades when you're 50, 55, 60, but then things start to kind of taper off and suddenly you become less
Invisible.
a person. Yes, invisible. And so depression is not a normal sequelae of aging. Losing all of your energy and not being able to get up in the morning or do the things you used to do or have fun, those are symptoms of depression, not age. They're just not.
Exactly.
Many providers, many doctors, nurses, physical therapists don't necessarily think about depression, and they want to be deferential and respectful to the elderly, so sometimes they fail to ask them key questions, not just about mood or suicide, but they fail to ask them all sorts of safety questions. You know, is someone abusing you? Do you wear a seatbelt? Do you drink too much? I mean, those are all questions that are fair game for anyone of any age that we want to provide good care to. But elders in particular are very vulnerable. The highest risk category for suicide is males over age 85.
Wow.
They have a higher risk of death by suicide than any other age group.
So that's something that loved ones should definitely be paying attention to, are the elderly, and to factor in mood changes and where they are with how they're feeling and acting.
Absolutely,
all the
and
time.
what's changed.
And what's changed.
And it is really okay to try to think about creating a safe environment for someone you love. If they are depressed and they're not yet ready to get help, there are a lot of people in Vermont, in surrounding areas, who have firearms in their homes. It's okay to remove those firearms. You don't necessarily have to take them to the police. You don't have to sell them. You just have to put them in a place where your depressed relative can't get to them.
Yes.
You can save a life that way, because when people are faced with a lack of access to a means for suicide, they often just don't try.
Right.
There's this myth that if someone really wants to kill themselves, they will find a way, and there's really nothing you can do. That is absolutely false. There are studies about people who've tried to commit suicide in various ways, and when impeded from that way, most of them just go home and will often say, well, maybe I meant to be alive. Or they may even say, well, I can't even do that right. But they're alive, and so I don't care. The fact that they lived through that moment and now they have a chance for their depression to be treated and they can feel better enough so that they no longer wish to kill themselves. That's what we're trying to get to, because those periods of suicidality are time limited. You're not consistently suicidal when you are depressed, and so you just need support and safety to get through those moments.
Well, on those notes of support and safety, sounds like that is a really great way to manage the holidays right there. I am going to thank you once again for joining us. It's really, you've told us a lot of information, and I hope that there are members of the Brattleboro community who really benefit from what you've had to say today. So thank you so much, Robin, for joining us today. And thank you to our studio audience for joining us as well. And thank you to BCTV, who works in conjunction with the Brattleboro Retreat and is very generous with their space, with their staff, and we couldn't do it without them. So thank you, and please join us again for Keep Talking, a community dialogue about mental health.